The Handihaler is a device that uses an individual capsule containing a fine dry powder to be inhaled into the lungs. Do not swallow the capsules and do not place the capsules in a pill box because moisture from the air may gum up the powder. To open the Handihaler, push the device's green button to release the dust cap like this. Pull the dust cap all the way open with your fingers. Then open the white mouthpiece by lifting the ridge to expose the center chamber like this. There's the center chamber. When you're ready to take your dose, separate one blister pack from the blister card by tearing along the perforated lines, and then open only one capsule by peeling the foil back. Do not use sharp instruments to open, so you don't accidentally pierce the capsule. Place the capsule in the center chamber, like that, and then close the white mouthpiece until you hear a click like this. Keeping the device upright with the mouthpiece pointing up, press the green button all the way in until it's even with the base to pierce the capsule, then release like this. If it's too hard, you can use a table or a cabinet to press the button. Never shake the device because the fine dry powder may spill out. After loading and piercing the capsule once, exhale completely but away from the mouthpiece so you don't blow out the powder. Keeping your head upright and looking straight ahead, hold the device at its base with the green button on the side. Never use a spacer with the Handihaler, and make sure you don't block these air vents around the device. Seal your lips around the mouthpiece and breathe in deeply through your mouth, making sure you hear a rattling sound while breathing in like this. Take the device away from your mouth. Hold your breath for up to 10 seconds or as long as possible. Then gently exhale away from the device. Then you're going to breathe in a second time with the same capsule, but do not pierce the capsule again. Once you're finished, you're going to open the white mouthpiece and holding the base of the device and the dust cap, turn the device upside down to let the capsule fall into the trash. Then close the mouthpiece like this, and then close the dust cover until it clicks shut. Do not touch the capsule after it's been pierced. If your hands accidentally come in contact with the pierced capsule, keep your hands away from your eyes and wash your hands immediately. If the powder comes in contact with your eyes, the anticholinergic effects may fix and dilate your pupils for up to 36 hours.